This is my video for donning and doffing PPE. So the first step of donning PPE would be doing hand hygiene for 20 seconds. After that's done, the first step would be to put on the gown. So when the gown is clean, we don't need to worry about which side is outside or inside as far as touching it, because it's clean and it's not contaminated yet. So I tied the strap in the waist, that's at the waist, and then tie the strap that's at my neck. The next step after putting on my gown would be putting on my mask. So I'm going to be using an N95 respirator, and this is to ensure that we don't have any particles entering the nose or the mouth. And it should have a good seal between the nose and the mouth, or else it's ineffective, meaning that no outside air should be coming in through any cracks or crevices that are caused by it not touching your face correctly. The next step after that would be putting on my face shield. This is used for splash precautions, or when there's a risk for splashing. The last step would be putting on my disposable gloves. And then just make sure that the glove goes over the cuff of the gown. And that's complete. This full set of donning PPE would be used for an airborne infection risk. We only use this face shield for splash risk. So to remove this, I would either do it at the door of the patient's room, or if it's an airborne precaution, then I would do it in an anteroom. So the first step would be removing the gloves. So I would grab the palm of the glove and remove it. And then with my clean hand, go underneath the other glove and then slide it out. And then I can discard of these. After that, I would remove my face shield, grabbing the strap from the back and forward, and then this can either be thrown away or reused. After that, I would remove my gown, so untie these straps in the back, and the back should technically be clean because we're only contaminating the front. Then I would let it fall a little bit, and I can slide my hand inside of one cuff, only touching the inside and pulling it out. Then using this cuff, I'll pinch and then slide out the other one. Then I would make sure that this is folded so that the outside part is folded within itself, so that we're only touching the non-contaminated part at this point. And since this one is reusable, we would put it in the hamper. If it's disposable, then we would just throw it away. The last section is taking off the mask. So removing the mask, and these can either be thrown away or reused as well. The last step after this is performing hand hygiene before leaving the room.